So COA got optometrists and staff to be prioritized during the immunization rollout. And so COA worked with the local health departments to get optometrists in the top tier to be vaccinated ASAP. So that was important work from the COA. COA, number 2, advocated with the state board to allow all CE to be online. And we just recently heard that that would be extended through the end of 2021. So that has been so important for people to get the CE. Third, California is one of the first states to allow administration of the COVID vaccines. 4, COA got early enactment of the telehealth law. So this mandates the health plans pay for telehealth visits that many optometrists are already doing. And some of the students, you guys have been involved in some of these telehealth visits during the pandemic. But it was also important that we separate out online vision testing to make sure that the law did not cover online vision testing. 6, COA represented California ODs to get financial help. That was really important for struggling businesses during the pandemic. So these were in the form of grants and also things related to the PPP deductibility. 7, COA made sure that there were free mobile clinics, that these would be allowed to operate to serve the needs of California patients, but also making sure that these were not run by for-profit entities. So California Optometric Association is ensuring that the quality of care is there for California patients. And then lastly, in terms of advocacy wins this past year, the COA defeated legislation that would have required optometrists in California to maintain like a PPE stockpile or be fined, which really is not making sense for individuals, especially with private practitioners. So I wanted to stop share in this one for now and just say that, California Optometric Association was really for our members in terms of navigating the financial relief options that were so much information coming so quickly. So COA created a website with a lot of resources related to COVID-19 and got over 100,000 views. So we heard back that members found it really useful when you had a quickly changing environment and knowing and wanting to make sense of things. And then lastly, COA held a lot of webinars, and also we have a resource, a legal resource that was very helpful for individual members. They can call up the COA legal team and ask questions as part of membership. You get 30 minutes of free legal counsel. And that was really helpful to navigate all the changes related to things, not just pandemic, but just in general in terms of things that happen in California. So I want to appeal to all of you as students that I know you've been a member of the COA as a student or a member of your state association for those of you who are coming back to California. And I just want to say, we hope to see all of you stay as members of your state association, be it California or any state association. By supporting the association, you can continue to advocate for optometry and help us as an association advocate for optometry. So being a member of the National Association, the AOA, and also the state that you'll be practicing in together, the associations really work to protect the ability for you to practice to the fullest scope of optometry and not to lose any of the things that we're able to do in terms of serving our patient. So we really only have one organization, which is the AOA, and for California is the COA. And if you think about it, it really protects your ability to practice optometry, right? So I want you to stay as a member after you graduate and as you continue to practice optometry. So every dollar you pay for the association dues really is insurance to protect optometry and what optometrists can do for our patients. So we really need every optometrist to become a member, stay as a member, because only then by large numbers can we really be as strong as we can be. So with that, I wanted to just recognize that today we have a lot of several COA board members, and just want to make sure to recognize them: Dr. Dexter, Dr. Kimura, Dr. Moy, Dr. Tu, Dr. Park, Dr. Lin. We're all here for you. I know you have some really good questions to answer later on, so look forward to participating.